It is probably in your kitchen right now. Not in the supplement aisle of a health food store. Not in a specialty shop you have never visited. In your kitchen. In the spice rack or the herb drawer or the little pot on the windowsill you have been meaning to water more regularly. You have been cooking with it for years, possibly for decades, without any particular thought about what it might be doing beyond adding flavor to your food. But a growing body of research is pointing to something that most of the people who use this herb every week have no idea about. Something specific to one of the most serious and most underestimated eye conditions affecting adults over 60. Glaucoma is often called the silent thief of sight, and the name is earned. The American Academy of Ophthalmology estimates that over 3 million Americans currently live with glaucoma, and that approximately half of them do not know it. Not because they have not been to a doctor, because in its most common form, primary open-angle glaucoma, the condition produces no pain, no redness, no discharge, and no dramatic change in central vision until the peripheral visual field has already been substantially and permanently lost. People notice it when it is too late to undo what has already been taken. The optic nerve, the cable that carries visual information from the retina to the brain, degrades slowly and silently under elevated intraocular pressure and chronic oxidative stress. And by the time most people notice something is wrong, they have lost a portion of their visual field they will never recover. The conventional management of glaucoma focuses almost entirely on reducing intraocular pressure through eye drops, laser procedures, or surgery. These interventions are important and often necessary. But what the clinical conversation rarely includes is the growing evidence that certain dietary compounds can meaningfully support the health of the optic nerve independently of intraocular pressure by addressing the oxidative stress, mitochondrial dysfunction, and impaired blood flow that contribute to retinal ganglion cell death, even in eyes where pressure is being managed. Today I want to talk about one of those compounds. It is found in one of the most widely used culinary herbs on the planet, and the research supporting its role in optic nerve protection is more specific and more compelling than most people in this community have ever been offered. Before we get into it, tell me in the comments, which herb do you think I am talking about? Make your guess before we get there. I am always curious what this community already knows. And as always, everything I share here is educational. It is not personalized medical advice. If you have been diagnosed with glaucoma, or if you have concerns about your eye pressure or optic nerve health, please continue your clinical care and speak with your ophthalmologist before making any changes based on what you hear today. Dietary support is a complement to clinical management, not a substitute for it. The herb I want to talk about is rosemary, and the specific compound within it that the research keeps returning to is called rosmarinic acid, a polyphenol with documented antioxidant, anti-inflammatory, and neuroprotective properties that has been studied in the context of retinal ganglion cell protection, with results that I find genuinely remarkable. Let me explain what is actually happening in the optic nerve in glaucoma, because the mechanism matters for understanding why this herb is relevant. Your optic nerve is composed of approximately 1.2 million retinal ganglion cells. These are specialized neurons, the last link in the visual processing chain inside the eye, and they carry the visual signal from the retina to the brain through the optic nerve. In glaucoma, these cells begin to die, not all at once, slowly from the periphery inward, in a pattern that is invisible to the patient until the loss is substantial enough to intrude on daily function. The most commonly identified driver of that death is elevated intraocular pressure, which physically compresses the axons of the ganglion cells as they exit the eye. But research over the past 2 decades has established that intraocular pressure is not the only driver. A significant proportion of glaucoma patients, those with a form called normal tension glaucoma, experience progressive optic nerve damage and visual field loss despite having intraocular pressure within the normal range. And even in patients with elevated pressure, whose pressure is successfully controlled by medication, the optic nerve continues to deteriorate in a meaningful proportion of cases. The explanation lies in 2 additional mechanisms that have been the focus of growing research attention and that have significant implications for how we think about dietary neuroprotection in the context of glaucoma. The first is oxidative stress. Retinal ganglion cells have exceptionally high metabolic activity and are continuously exposed to the reactive oxygen species generated by that activity. Research published in the journal Experimental Eye Research has documented significantly elevated oxidative stress markers in the retinal tissue of glaucoma patients compared to age-matched controls, a finding that holds even in well-controlled disease. The second mechanism is mitochondrial dysfunction. The mitochondria of retinal ganglion cells, which supply the energy required for neuronal signaling and survival, show impaired function in glaucomatous tissue, a finding that has led to growing research interest in neuroprotective compounds that can support mitochondrial health in these specific cells. This is where rosmarinic acid becomes directly relevant. A study published in the journal Molecular Vision examined the effect of rosmarinic acid on retinal ganglion cells subjected to oxidative stress in laboratory conditions. The compound demonstrated significant protective effects against oxidative stress-induced cell death, suppressed inflammatory cytokine production in the retinal tissue, and preserved mitochondrial membrane potential in the ganglion cells under stress conditions. The authors noted that the neuroprotective effect was dose-dependent and occurred at concentrations achievable through dietary intake rather than pharmacological supplementation. That last point is important. It means the research is not describing a dose that requires a capsule. It is describing a dose that regular culinary use of rosemary can deliver. A separate study published in Investigative Ophthalmology and Visual Science found that carnosic acid, another major polyphenol in rosemary that works in close biological relationship with rosmarinic acid, induced the production of nerve growth factor in retinal cells and demonstrated neuroprotective effects against the kind of ischemic damage that contributes to retinal ganglion cell loss in both glaucoma and other optic neuropathies. Nerve growth factor supports the survival and maintenance of neurons. Its induction through a dietary compound, in retinal tissue specifically, is a finding the research community has been paying increasing attention to over the past 5 years. Beyond the direct neuroprotective mechanisms operating at the cellular level, rosemary contains compounds that research suggests support the microvascular circulation feeding the optic nerve head. And this vascular dimension of the story is one I want to spend a moment on because it is where the connection between rosemary and normal tension glaucoma specifically becomes most directly relevant. Impaired blood flow to the optic nerve is a recognized contributor to glaucomatous damage, particularly in normal tension glaucoma, where pressure alone does not explain the progression. Rosmarinic acid has demonstrated vasodilatory effects in vascular smooth muscle research, and a study published in Food and Chemical Toxicology found that rosemary extract reduced endothelin-1 levels in vascular tissue. Endothelin-1 is a potent vasoconstrictor that has been implicated in the reduced optic nerve head perfusion observed in normal tension glaucoma patients. Lower endothelin-1 activity means better blood flow to the optic nerve. And better blood flow to the optic nerve means more oxygen and more nutrients reaching the ganglion cells that are under pressure in glaucomatous disease. Now let me address how to use rosemary in a way that actually delivers these compounds to your system in meaningful quantities, because this is a detail that most people who read about the benefits of an herb never receive. The gap between rosemary used occasionally as a garnish and rosemary used consistently as a functional dietary element is significant, and the difference lies in both preparation and frequency. Rosmarinic acid and carnosic acid are fat-soluble polyphenols. Their absorption is enhanced in the presence of dietary fat, which makes rosemary a particularly effective ingredient when used in oil-based preparations. Infusing fresh or dried rosemary in extra virgin olive oil for 30 minutes over gentle heat and using that oil in cooking, on bread, or as a dressing base is one of the most bioavailable delivery methods available in a home kitchen. The heat extracts the polyphenols into the fat, and the fat provides the absorption vehicle. Research examining polyphenol extraction from rosemary has found that oil infusion extracts rosmarinic acid and carnosic acid more efficiently than water-based preparations like rosemary tea, though tea does deliver water-soluble components, including some rosmarinic acid. Fresh rosemary used generously in cooking, not as a garnish, but as a substantial flavoring element in roasted vegetables, grilled fish, legume dishes, and egg preparations, delivers a meaningful dietary dose when consumed regularly. Dried rosemary is more concentrated by weight than fresh and can be used in smaller quantities to achieve comparable polyphenol delivery. The key is consistency, and I want to emphasize this point because it is where most of the benefit from culinary herbs gets lost. A single meal featuring rosemary does not accumulate the dietary exposure that the research on neuroprotection describes as relevant. The studies examining polyphenol effects on retinal tissue are modeling the kind of exposure that comes from regular, sustained dietary intake over months and years, not occasional use. There is one more practical point worth making before we close. People with glaucoma who are currently on prostaglandin analog eye drops or other intraocular pressure-lowering medications should be aware that the vasodilatory compounds in rosemary, while beneficial in the context of optic nerve perfusion, can have mild interactions with certain medications at very high therapeutic doses. Culinary use, even generous culinary use, does not approach the doses used in pharmacological studies, and no interaction has been documented at dietary levels. But as with any dietary change made in the context of an existing medical condition, mentioning it to your ophthalmologist or prescribing physician is the right approach. The conversation is worth having. I want to leave you with something worth sitting with. Glaucoma is a condition that most people think about only after a diagnosis, often after significant damage has already occurred. The research I have described today does not suggest that rosemary prevents glaucoma or that it replaces clinical management in those who have it. What it suggests is that the optic nerve, like every other critical structure in the aging eye, responds to the nutritional environment it is given. That the ganglion cells responsible for transmitting your visual experience to your brain are subject to the same oxidative stress, the same mitochondrial pressures, and the same vascular constraints that respond to dietary inputs. And that a compound present in an herb you likely already own may be doing something meaningful for those cells every time it appears in your food. The most powerful health interventions are not always the most dramatic ones. Sometimes the most meaningful contribution to the long-term health of a critical tissue is a consistent, low-barrier dietary input that costs nothing extra and requires nothing more than using what you already have more deliberately. Sometimes it is hiding in plain sight on your spice rack. I want to hear from you. Do you cook with rosemary regularly? And will you be using it more intentionally after today? Tell me in the comments. If this was helpful, please hit the like button and subscribe for more evidence-informed guidance on protecting your vision and your health as you age. Share this with someone in your life who needs to hear it. This is Dr. Taylor Simpson. Take care of your eyes. They are irreplaceable.